Welcome to Doylestown Health VIA Maternity Center, Part 2, Getting Started with Feeding Your Newborn. We have included a few brief pointers to help you get off to a good start with feeding your newborn. Our staff will be spending more time educating, answering questions, and supporting your feeding choice throughout your hospital stay. Take a look at the poster on the wall in your room with the signs of newborn feeding cues. This will help you determine when it is best to feed your newborn. If your baby is sleeping and making sucking movements of lips or placing the fist to mouth, these can be signs of readiness to feed. Feeding your newborn before they show late signs of hunger, which is crying, will be less stressful for baby and parents. Feeding your newborn, getting started. Babies love to be near their parents. They feel safest when they can touch, hear, and smell their moms. For their comfort and yours, our staff will provide all baby care at your bedside and encourage you to keep baby with you. Keeping baby at your bedside allows for parents to learn baby's early feeding cues, therefore making it easier to breastfeed more often and build mother's milk supply. We find that babies cry less when they are near their parents. The better you get to know your baby here in the hospital, having the support of our nurses, you will find yourself becoming more confident in caring for your newborn as you prepare to go home. Feeding your newborn, getting started. Look to our nursing staff for guidance. You are not in this alone. All of our nurses are skilled and very capable to assist you with feeding and caring for your newborn. Lactation consultants are available in addition to the support of your primary nurse. With Skin to Skin, everyone wins. Hopefully, you have had the opportunity to spend skin-to-skin time with your baby immediately after birth. Placing babies skin to skin is not just encouraged after the birth, but as frequently as you would like. Skin to skin will ease baby's transition to the outside world, all the while feeling safe, listening to your heartbeat, feeling your warmth, and taking in your scent. We encourage mothers and partners to snuggle up and keep baby calm, placed heart to heart, bare chest to bare chest. Skin to skin helps to stabilize mom's hormones and is very beneficial for successful breastfeeding. If you will be breastfeeding your baby, we look for 8 or more feedings in 24 hours. Sometimes the first 24 hours of life, the baby is very tired, sleeping most of the time, so it's key to watch for their feeding cues and to wake them when they show signs of readiness. Placing a baby skin to skin is a great way to ease your baby awake and to get him ready to feed. The nurses will provide you with more detailed information and of course assistance as you get used to this new experience with your baby. We recommend avoiding pacifiers or bottles until breastfeeding is well established for the first 3 to 4 weeks if possible. The reason? Sometimes baby has a preference for the artificial nipple and may not easily go back and forth. And also, a baby does suck differently from an artificial nipple, possibly causing mom to develop sore nipples. Sometimes we wonder as parents, is breast milk enough for my baby? It is suggested to avoid formula unless there is a medical reason. Breast milk is complete nutrition and should be all your baby needs. By introducing formula, you can actually reduce the stimulation at the breast, therefore affecting mother's milk supply. It may also change the baby's normal intestinal bacteria, increasing the risk of infections. If you have any questions or concerns, please talk with your baby's doctor, lactation consultant, or nurse. If you have chosen formula feeding, you will want to feed according to baby's feeding cues and watch for signs of readiness. If your baby is sleepy and difficult to wake for feedings, placing her skin to skin is a great way to ease your baby awake and get her ready to feed. 6 to 8 feedings is what you should expect in a 24-hour period. So whether you are breast or formula feeding, take a look at the size of your baby's tummy at 24 hours of age, day 3, and at 1 week. They don't need a lot to eat, especially in the first 24 hours. Breastfed babies will receive about a teaspoon of milk per feeding, and when bottle feeding, babies should receive no more than 10 mLs at each feeding for the first 24 hours. More information to come from your nurses on how do I know my baby's getting enough. This is a very common concern for all new parents. Feeding and diaper log. It will be important during the early days to keep track of your baby's feedings and outputs both in the hospital and at home. For ease of determining if baby is getting enough, the log is divided into the first 24 hours of life through the 5th day of life and clearly states the minimum amount of wet and dirty diapers required for each day. We ask that you log all feedings, attempts, and amounts, and note the time and color of baby's wet and dirty diapers. Paced bottle feeding. When feeding your newborn from a bottle, it is important to help pace his or her feeding so that your newborn doesn't eat too fast and become overwhelmed. When we pace bottle feed, it helps to slow down the feeding, allowing your newborn to comfortably suck, swallow, and breathe with ease. This allows the baby to be in control of the feeding. Ask one of our nurses to demonstrate paced bottle feeding for you. How to burp your baby. An easy and an effective way to burp your baby is to 1. Sit baby upright on your lap. 2. Place your thumb on one side of jaw and index finger on the other side of jaw. This will provide support of baby's chin and head. Just remember to keep your hands away from the baby's neck. 3. Lean baby forward and firmly pat mid-back. Burping before and after each feeding is recommended, but not all babies will have a need to release air. Feeding a baby is such a special time, so whether you have chosen to breast or formula feed, keep baby close to you and begin to get to know each other. There are times when feeding your newborn may have challenges not anticipated, but that's okay. Our staff will help you get off to a good start, and by the time of discharge, you will feel more confident.